For an IV initiation, you will need an IV start kit. IV start kits will look differently depending on where you're working, but they will typically include securement tape, some sort of prep, whether there's alcohol pads or an actual prep device, a tourniquet, a securement device, and some gauze. You will also need your IV catheter and needle. Your size that you need will depend on what's going on with your patient. Typically in the hospital, you'll see anywhere from a 22, 20, or an 18 gauge needle. 22 gauge needles are going to be typically for your pediatric patients or for your older adults because they're a smaller needle. 20 gauge is most commonly used in the hospital. 18 gauges are going to be used in more of your high-risk situations if there is a potential for blood loss. You will also need extension tubing. This is sometimes called a J-loop. You will also need an IV flush. When you first open the IV flush, there will be air, so you'll just need to make sure that you expel that air. An easy way to do that is to pull back on the plunger and then to slowly push out that air. After you're done with that, go ahead and take your IV flush and connect it to your extension tubing. You will flush this tubing all the way through to make sure that there is no air in the line. Keep it just like this until you're ready to use it. There will be a little cap at the end. I find it's helpful to just loosen that cap a little bit, but still keeping it covered. You never want the ends of your IV tubing to touch anything. Now we will go ahead and get started. Now we will perform venipuncture and insert the IV. Place a linen saver pad underneath the patient's arm. Have the patient place their arm in a dependent position. Apply a tourniquet tight about 4 to 8 inches above the selected site. Make sure that it is not too tight or that it is left on for an extended amount of time. Locate a vein for inserting the IV catheter. Select the most distal vein on the hand or the arm. Avoid using an arm or a hand that contains a dialysis graft or fistula, or the affected arm of a mastectomy patient. When feeling for a vein, lightly press down and make sure that it rebounds quickly. The best veins for IVs are ones that you can feel that are bouncy and ones that you can see. After selecting a vein, loosen the tourniquet. If there is excessive hair in the area, you may choose to clip it. Don clean, non-sterile gloves. Use an appropriate IV catheter. Typically, you will see sizes 22 gauge, 20 gauge, or 18 gauge used in the hospital setting. Open the catheter package. Gently reapply the tourniquet and scrub the site using friction. Allow the site to completely dry and do not fan the site. Pick up the IV catheter and inspect the tip integrity. Inform the patient that there will feel a little stick when they insert the needle. There are 2 types of needles that can be used, a wingtip, butterfly, or the over-the-needle. We will use the over-the-needle IV catheter for this video. Grasp the catheter by the hub using the thumb and the forefinger of the dominant hand, making sure that the bevel is facing upward. Using the non-dominant hand, stabilize the vein. You will want to hold the skin very taut. Hold the catheter at a 30 to 45 degree angle, piercing the skin directly over the vein. When flashback occurs in the chamber, lower the catheter angle to the skin level and advance the catheter and stylet into the vein. While holding the catheter in place with one hand, release the tourniquet and remove the stylet from the catheter. Quickly connect the administration set or extension tubing to the IV catheter using aseptic technique. This may involve twisting the lure lock. You will want to do this quickly as there will be free flow of blood from the catheter right after initiation and insertion. Secure the connection between the tubing and the catheter. While stabilizing the catheter, slowly open the roller clamp and allow for IV fluid to flush into the catheter. You may also use the J-loop here and use a flush to administer fluid into the vein to ensure you are in the correct site. If fluid is easily able to be inserted, you know you are in the correct area. Also assess the vein at this time when you insert the fluids to make sure that there is no infiltration. Dressing the site. Stabilize the catheter with a manufactured catheter stabilization device, sterile tape, or sterile surgical strips. If needed, clean the site with an antiseptic swab and allow it to dry before applying the dressing. Sometimes this is needed as blood may drip out during insertion. Smooth the remainder of the dressing so that it adheres to the skin. Label the dressing with the date and time of insertion, catheter size, and your initials. Secure the IV administration tube by looping and taping the tubing to the patient. Dispose of all of your supplies, including sharps, and document the procedure. Complete the ending 4 tasks.